the fall in cases, obviously they've been lowered sort of week on week this week, and other positives too. Is it down to the vaccine?
Well, let's focus on two groups. First of all, residents of long-term care settings. We see a big reduction in the number of lab-confirmed cases up until the week of February the 14th. At the end of that week, 482 cases. Now the week ending 1 week later, down to 91. Some of that can be explained by the fall in community transmission, but the fall is so huge, it's very tempting to say that it's at the very least a big contribution by the vaccine rollout. The other big figure, Ciara, is the fall in healthcare workers. We see a fall from just over 1,000 cases just a few weeks ago to now 50, 60 cases. Big drop, and that coincides. If we track that, it coincides with the vaccination. But more importantly, if we didn't know what had happened in Israel, we would say, well, that's maybe a signal. We'd have to wait some more time to read into it. But we know these are the signals Israel got, and now there's really strong evidence coming from Israel, from Scotland, and other places of big drops in hospitalisation and serious illness in all age groups beyond what even the trials might have predicted.
Okay. That sounds very hopeful, and God knows we all need a bit of hope now. One of the things we've covered on the show several times in the last week or two is families coming on air talking to us about nursing home visits. Will this allow some change to be brought about, Colm, that the residents appear to be not getting infected to the same extent? Certainly the deaths and the cases are falling. Will people be allowed to see their loved ones? In
short, it should and it will. But just to remind people, we're coming out of a month, January, where there were over or almost 1,300 deaths from COVID, many of them in nursing home settings. So we need to, one of the big dividends for nursing home residents, of course, is the huge drop in illness and in serious illness, and particularly in death, that will result as a result of the rollout of this vaccine there. But yes, of course, we want to resume visits in some kind of controlled way, in some kind of safe way, as we did before. And we're looking at this right now to see how we can reintroduce those, bearing in mind we're just coming out of a serious surge in cases, which had a very significant impact on nursing homes.
You mentioned the fall in cases among healthcare workers down to 50 or 60 from 1,000. So, and that's coinciding with the lowest levels in hospital of COVID-19 as well since January. Is the health service therefore out of the woods? We've more staff available and we've less patients with COVID-19. Have we crossed that Rubicon? Are we in safe territory now?
Well, we're never out of the woods in health service. There's no such thing as steady state in health service. But certainly, when we look at what we were most afraid of, the real question is, Ciara, what is our biggest concern? So our biggest concern a month ago, if I was sitting here with you talking, was will we be able to cope with the huge surge in cases? Will our ITUs be overrun? Will we see people dying in corridors outside intensive care units where we can't provide care? And things got very close. There's no doubt about that. We had to build up our ITUs beyond our core capacity of 290 beds odd, and we're providing intensive care to upwards of 330, 340 patients. So it came very close. There's no doubt about that. Of course, now as things begin to recede, we start worrying about other things, such as unmet need, such as services that were suspended, such as the things that were concerning us towards the end of last year, which was, for example, people not presenting with symptoms.
And the non-COVID healthcare. And I absolutely appreciate how important that is. But in terms of us becoming overwhelmed, in terms of the health service being under the kind of pressure, as you say, the fear that our surge capacity wouldn't cope, are we out of those woods?
We seem to be, but I would. The hard lesson for all of us is complacency is so dangerous in this game. Look what happened in December. We were the best performing country in Europe at the beginning of December, and we went to be almost the worst. In a month.
We're 20th now, so
that's right.
That's pretty good.